The federal weighman says he doesn't know where he picked up the virus. When he realized he was sick, he was at work. And he says it took 102-degree temperature days later before health officials would test him. As he tells KIRO 7's Deborah Horn, he hasn't been back to work in 3 weeks.
Sean Ryan tells us he was at work on March 19th at this aerospace company when he suddenly felt ill. Still, he worked for another 5 hours before he finally went to his bosses and told them he was too sick to stay. He had to go home. How did you feel when you got home?
Very weak and very dizzy, and I just laid down on the bed.
The 59-year-old federal weighman spoke to us by telephone from his room at Tacoma General Hospital. He says he went first to Kaiser Permanente in Tacoma.
Did a CAT scan on my lungs and my heart and told me that I was fine, and they let me go.
And then you went back home?
And became very, very sick.
He couldn't eat.
And I was just viciously dizzy and weak, and I had a great big fever, and I went back to Kaiser Permanente.
That time he was tested for COVID-19 and admitted to Tacoma's Allen Moore Hospital, but after 2 days he was again sent home. And then what?
And then that's when I got a call from the clinic saying that I was positive for the C19.
COVID-19.
Yes.
He was readmitted to Allen Moore, he says. Then last Sunday he was transferred to Tacoma General. He has hardly eaten, thinks he lost about 25 pounds, and he says he is better.
Not any more shortness of breath. I was able to get up pretty well. The congestion in my chest is eased up some. The coughing is eased up some, but I'm still coughing up stuff.
But his story raises some troubling questions. Did he infect any of his co-workers while he was still here sick? Did he infect any of the healthcare workers before he was tested for COVID-19? We're working to bring you some answers in about a half hour. For now, reporting in Auburn, Deborah Horn, KIRO 7 News.